we do all the kind of educations during this. So creating a new model or a new lifestyle that people can feel safe, using public transport like MRT. So that will be the new business of MRT.
From Jakarta, I'm Jeff Hutton, and this is On the Level. We're going to spend a little time in the coming weeks on cities and how they work in this part of the world. And this is key. Jakarta makes up about 2/3 of Indonesia's GDP. If you add up the residents of the city itself and its satellite cities, you approach the combined population of Australia and New Zealand. A big chunk of that 30 million or so people are here from somewhere else. Even when the government banned the annual migration home at the end of Ramadan, 2 million are thought to have slipped away. So making cities safe and improving livability is going to be an important part of the ongoing efforts to combat this pandemic, which may be with us for many more months to come. So today, we talk about Jakarta's MRT. 30 years in the making, the MRT finally started operating early last year, and it opened to huge fanfare here, an enormous source of pride. It was Indonesia's first underground train. It was big, clean, and dependable. It had the look and feel of a metro line anywhere else in the world. It's only 16 kilometers long, but is part of a years-long effort to coax people from their cars. But COVID-19 is threatening to undermine that effort. And that's a frightening thought, because traffic is already some of the worst in the world here. In 2018, the government estimated Jakarta suffered $7 billion in economic losses because of slow-moving traffic. I spoke with MRT's President Director William Sabandar, who says it's critical that public transport win passengers back. The first step, he says, is safety. Cars will take 70 passengers max, and no talking rules will be in effect, lest passengers spray the virus through the car. I find William Sabandar just extremely impressive. He oversaw the government's reconstruction efforts in Aceh after the tsunami struck there in 2004. He's someone you want to lead you out of a crisis, and I hope you feel a little bit more confident about the future of public transport in general after our conversation. Okay, here's the interview. Bob, William, thank you so much for joining me on The Level.
Thank you.
When the MRT opened, there was quite a lot of fanfare. It was considered a big event. It was highly significant for Jakarta. I wondered if you can explain to listeners who may be unfamiliar with the city and unfamiliar with the infrastructure about how significant it is and where it sits in the overall plans for Jakarta's public transport plans.
Yes, first of all, the MRT Jakarta is the first metro project in the country. It's a big country, 270 million people, but Jakarta MRT is the first in the country. And it was actually a long-awaited project. It's 30 years, actually. It took 30 years before we finally get the first MRT runs last year in March, officiated by President Jokowi. And I think it really elevated the status of public transport in the country. Before MRT, you can see the issue of people queuing and comfort using public transport. With MRT, with the discipline, with the on-time performance of the train, with the systems, automatic system that we develop, in a sudden, you see the change of behavior of people transport along the line. And the message transfers across Jakarta population, Jakarta people, but also in the country, that Indonesia can finally have one public transport which people can see that a good public transport is there with on-time performance, with automatic systems, when people is adapt with the queuing system, when people are respecting each other, when a disabled community can have a space, can travel using a modern public transport. And this has really changed the landscape of transport system of the country. So it's what I say when it was launched, the next day in all newspaper they said it's the new era for public transport in Indonesia. It's not just the way, or this is because it's only 16 kilometers. It's nothing. It's very small impact to, although there is an impact to reduce the traffic jam of the city, but it's more on the lifestyle impact. Now people are using MRT. It's not just because of the travel, but they see it's actually promoting the new way of travel in the city. If in the long run you want to reduce the traffic jam of the country. On the more analytical measures, the country moved from, because of the MRT, some survey has shown that the city is from the fourth most traffic congested city in the world. Now it's to the 10th. So there is a situations which, because of MRT, then it elevate the status of public transport, and there is an integration with other transport of buses, bus rapid transit, and people start to use transportation, public transportation. So that has happened over the last year, Jeff.
I think it needs to be pointed out too that the system was built as a consortium with Japanese and Indonesian companies, and the design is very advanced. It looks good. It operates well. There's a feeling of safety, security, and efficiency. And you move through very busy intersections. You're looking down on the congestion below and feel well, maybe a little smug. But what do you think the psychological impact or the view that residents may have of the city when they've got access to top class infrastructure that they would probably only see on visits to Singapore or to Bangkok?
Yeah, it's one is you can actually see that public transport is for everybody. It's not just for people with middle income down, but now you can see ambassadors using MRT, CEO using MRT, the governor is actually riding MRT regularly. So psychologically, you can see MRT or public transportation become the place for everybody, the rich, the poor, and all the people. Very much a disabled community now feel like they have the space, and you can see this is the environment that is not before you can enjoy in public transport. So that kind of euphoria is happening in the city, which I call it is the change in the lifestyle. So MRT bringing a new lifestyle. You can see, for example, the environment of people walking along. Before, you cannot see in the main street of Sudirman and Tamrin, people walk or people bike. Now it's you see, because the MRT integrate with a good walkway, and now government put bicycle way. So that kind of things change the lifestyle. So there is a new lifestyle in Jakarta since the coming of the new MRT system. And you are right. This is something that I myself didn't expect before. Before, when it starts, I think it will be difficult to teach people queuing, for example. It will be difficult to give to set aside a priority seat, for example. But when you have the systems good, when you have on-time performance, which 100%, and people become disciplined. People now can plan. Normally, for example, you can in Jakarta before MRT, you can only plan one meeting a day. You cannot move. Once you move, you need 1.5 hours to move to one place to another place. With MRT, you can put your meetings along the stations, different stations. You can have 4 or 5 meetings in a day because you just simply travel along the line, which was not the case before. So many psychological impact.
Well, yeah, I think that needs to be pointed out. I don't mean to talk over you, but I think that needs to be pointed out, is that if anyone who comes to Jakarta on a business trip plans no more than 1 or 2 meetings a day. Otherwise, it's probably impossible to move through the city because of traffic. And it's tiring. it can be, if you're on the back of a motorcycle, as I very often am, it can be very hot. And not terribly comfortable. It can be very frustrating. But when you've got a piece of infrastructure that performs very, very well and demonstrates the best that can be expected of public services, it seems from what you're saying, it's as if you get the best behavior back. The people mirror that back to the service by queuing, by refraining from eating, by not smoking, by by being on their best behavior. They feel like they've been treated well, and they treat the infrastructure well.
Exactly. So people respecting the system, and in return, they will respect others, and they will try to replicate this. If in Jakarta we can do this, previously Indonesian, when they go to Singapore, they can follow the systems, but they go back to Jakarta because of there is no good service, and so the practice become chaotic. Now they can see it can happen in Jakarta. So if we can do it in MRT Jakarta, why cannot we in best transport system, in best rapid transit? So that behavior then translated into this process. Now the governor introduced integrated systems, and you can see in a sudden that this permeates into all the transport system, including the train, the bus, the small bus to the feeder system. So respect and appreciate the system. I think that will be the message, which then people will try to see, okay, then we can have this kind of thing in Jakarta. And because of that spirit, I think it's now MRT become a symbol of change, of how the behavior of being disciplined, respecting, promoting all kind of community, respecting people with priorities, disabled communities. Those are the things which I think in myself it's something that has changed since the new transport system happened in Jakarta.
Where does the MRT, this particular MRT and others like it, where does this sit in the overall plan of making Jakarta a more livable city, of improving livability and sustainability, and making it some place where businesses may want to set up, as opposed to, well, frankly, sometimes avoid, because it can be a very tough place to move through. Although I personally like living here, but it's taken some getting used to. Where does these big set piece infrastructure sit in an overall plan to make Jakarta a global or at least a regional center?
Yeah, one of the main intentions, for sure, it's make Jakarta livable with a good transport system. And to have a good transport system, I think from 16 kilometers, we have a master plan to develop into 300 kilometers of MRT network. This is in terms of infrastructure development. By then, you can actually, because now it's the model split, the number of people using public transport is very low, only 20%. So we plan to change it in the next 10 years to be 70% by extend the line of MRT, integrating with BRT and LRT. But what is more significantly, and this is something that actually changed the way city is designed, or city being built, is Jakarta has been wrongly developed for some reason. It is very much car-oriented development. So the city is developed by following the roads, which actually trigger the number of private vehicles to there. Now the governor is introducing the concept of transit-oriented development. So development is no longer following the road, but following the MRT line, following the transport line. So we are now moving from car-oriented development to transit-oriented development, because we see now the impact. So what does it mean? Along the line, for example, we have 13 stations of MRT. We are building in all the stations now the transit-oriented development along the station, which is giving more density to the area around the station, so people can live, people can do activities in around the stations, and that's provide those areas becoming less congested because people are not using cars or private vehicles anymore. Now, so moving from heavily road-based development now to public transport development, to rail-based development, with transit-oriented development become the course. And I think this is the right way. If you see cities around the world, Singapore, for example, Hong Kong, London, they all actually focus the development of properties or activities along the metro line, along the train system. So I think this is another big change that I think in the short term will make Jakarta a livable city.
Viewing this change or the support of this change in sort of carrot and stick terms, the carrot in this case is the cheap, efficient, comfortable transport that is the MRT. But also the stick is limits on car usage, such as the odds evens that limit access to the big thoroughfares. But also perhaps surge pricing, road pricing. Where do you sit on that? To what extent do you think that you need to introduce road pricing, especially in view of the fact that I think ridership has fallen in the past year? Do you think you need to follow up with a few more sticks?
Yes, for sure. This is part of the schemes. Putting levy on private vehicles, electronic road pricing needs to be in place. Putting higher parking fees, which is in Jakarta, it's still very low park. So this is the plan. But when you push ahead the transit-oriented development, you have to discourage the use of private vehicles and incentivize the use of public transport. And like you say, it's electronic road pricing will provide measures to do this kind of incentive and disincentive mechanisms. Putting the parking tariff higher in the CBD will also putting these kind of things. So I think we are on the right track, and this kind of measure is being done by Jakarta government.
And in a place like Jakarta, where the vast majority of people do rely on at least scooters, two-wheelers, if not public transport. Putting a tax on cars would have an equalizing effect, wouldn't it? Or the people who can afford it should be able to pay for it, and it would be almost redistributive. Although I'm not sure if you would want to put it in those terms.
Yeah, that's in fact, it's my idea is actually there should be a progressive tax for people having more than one, for example, car at home. So and also for sure, it also the policy needs also to be done for a motorcycle as well. So that kind of policy needs to be in place in terms of the use of private vehicles. But my concern is very much at this stage is actually for cars, private cars. That actually needs to be put more levy or tax if people with this wanting to travel to the city. I think that's my opinion at the moment, Jeff.
It's no secret that the pandemic, COVID-19, has made public transport seemingly more dangerous. It's certainly because of the social distancing and the closures of businesses, ridership is down. Yeah. But also there is a sense that they can be vectors for disease. There were a number of deaths, I think more than 30 or so, from public transport workers in the UK, for example. The metro, the subways in New York, also a hotspot for disease. How does public transport react? How can it be resilient in these sorts of conditions and encourage people out of their cars back onto public transport in a way that they feel safe?
Okay, I have to give a bit background on this, Jeff. Normally, ridership of MRT Jakarta is 100,000 passengers per day. By the time COVID attack in March, and the government starts to introduce the social distancing measures and asking people to stay at home, work from home, study at home, right? And MRT is part of the system that support that. We are also closing our 50% of our station was closed. And the distance, we operate only from 6 to 6 p.m. And the headway is from normally 5 to 10 minutes, the headway becomes 30 minutes. And that brings down the ridership from normally 100,000 to only 5,000 people. So 95%, we are losing 95% per day, which is very hard for the business. Now it's being eased since Monday, yesterday, governments tried to lose a bit. We are in the transition process. And we open again the operations since Monday, yesterday, MRT start to operate normally, although not to 12 o'clock, but now it's 9 p.m. The ridership is starting, and we are getting into 20,000 now. It's still 20%, but we have the indication that it's going up because now it's just 50% office that works, and mall is has not opened yet. But what actually the new failure of the public transport is actually, one is we make our system, so during the transition time, we prepare mechanisms to promote public transport, especially MRT, to be a public transport that's safe, healthy, and secure from COVID-19 for people. So that kind of measures we are very disciplined to implement in MRT. We are putting marks, stickers with the distance of 1 to 1.5 meters where people should stand in the train along the queuing line, the given quota. So normally our train, which can carry, for example, one car can accommodate 250 people. It's now only maximum 70 people, which will bring down the ridership. But during this time, post-COVID, ridership for me or for MRT Jakarta is not single measure anymore, single objective. We need a new rebranding of the use of public transport as a facility to promote health, secure and safe transportation, public transportation for people travel. So we dedicate ourselves to be an example. And the trust start to be there. You can see now, this morning I talked with people in the stations, and people start to feel, oh, if this is the public transport, I will go back to use the public transport again, the MRT again, because cannot use the private cars. So the Jakarta will go back to the crazy situation with traffic jam if it goes back and then people not public transport. So the only way is actually you need to promote the use of public transport, but heavily impose the social distancing measures. You have to impose that all passengers using masks every time. They cannot talk or using a mobile phone in the station or in the train. They have to make sure the body temperatures, disinfectant of the train. They have to use the hand sanitizer, and we do all the kind of educations during this. So creating a new model or a new lifestyle that people can feel safe, using public transport like MRT. So that will be the new business of MRT.
Just out of curiosity, Pat, why can't people use their mobile phones?
Because droplets, people speaks, according to the research. They can share the droplets. Even they use masks. If you use clothing mats, it's still can spread. Will threaten your other passengers. So we apply that in MRT.
And will you increase the frequency of the trains in order to prevent crowding on the platforms with the restrictions?
That will be the plan. So we are encouraging the flexible working hours. So now our ridership we do the simulation. Our ridership will go to 70,000 passengers per day in the line. And if the office start to do the flexible working hours, we can actually expand our peak hours. So now it's only 2 hours in the morning and 2 hours in the evening. We can increase to 3 hours to 4 hours, in the morning and in the evening. So it will accommodate more passengers, but in a social distancing scheme.
Imagine a world, hopefully in 6 to 12 months, in which there is finally a vaccine, or at least very safe and effective treatment, in which, and then presumably life might return to normal. Would the impact on public transport, such as the Jakarta MRT, be long-lasting, do you think? Or are memories very short? Or will some things just be here to stay?
Well, COVID has taught us big lessons, and it changed the way we operate. And one of the things is actually healthy and safe, secure public transport system is actually in the top of priority. I think even vaccine is fine. I think people will always remember this event. Yeah, it's a very bad situation. A lot of people died, and I think that will be the momentum to tie or to create a very like a clean, hygiene public transport system, and by putting health measures as one of your important indicators, in addition for sure to ridership. And also, I think that will also put to government and people or operator to design a more integrated system with walking and bicycle. So this is actually the momentum. I went out and see a lot of people now biking, and a lot of people do the walking. For me, it will stay. Even the vaccine is fine. So it's for us to be relevant. We have to move from the way we did business previously and engage into the situations. Number one, not just on ridership, but using MRT as the symbol of safe, secure, hygiene transport system, not just relying on ridership, but also promoting branding on non-fare box. Yeah, from the income perspective, we have to work together with other measures to get that, and also to promote the mechanism of transit-oriented development, because by having healthy society, then you can continue to have people using public transport in the city.
What is your perception of how officials have been handling this outbreak? Do you think that there is sufficient trust among the people in order to follow the sort of measures that you yourself are introducing? I ask this because there was a study published in Forbes magazine by a group in Hong Kong that listed Indonesia toward the bottom of about 100 countries in terms of COVID safety. I don't know if you saw that. Yeah. Switzerland, Germany, Singapore up towards the top. I don't know if you want to comment directly on that, but is it as bad as all that, do you think? Is Jakarta an unsafe place to live?
Well, for sure, leadership matters. And then I agree with you. It's we need a strong leadership in managing this crisis. Only a government provides strong leadership can lead and can survive in the process. And I see it happen in Jakarta. It's a strong leadership by the governor and the president. I think in the case of Jakarta, you can actually, specifically in Jakarta, you can see the trend. Outside Jakarta, it's going up, but Jakarta show a good trend during the introductions of social distancing measures, and we are now in the transition process of PSBB, of the social distancing measure. And if this continue, I think this can be a good example. Leadership should be provided at all levels by international government, by national government, by provincial government, and by local government, and the message should be clear. In the case of Jakarta, I can see this happen, and people trust a lot. And then you can see if you say working from home, and people will follow, and people have to use mask because government will give you sanction if you don't. You can observe in Jakarta now people wear masks, yeah, and this is the case, yeah. The issue with, for example, we have lower health facility to do rapid tests or to do PCR. That is something that we have to do. I think we have to accelerate. But the measures by government in terms of protecting the society, as people having masks all the time, as people making social distancing all the time, and washing hand and this kind of thing being campaigned. I think this is something that's something that is very good in Jakarta. You can see that situations, and I do hope during the transition process, because what you see, people come back to work now. You can see in this process, this will be the test for Jakarta. If we are able to pass this transition process, the case can continue to go down, and then maybe by next month we can start to move to the new normal phase. But if we fail, then maybe the second wave will come. But I'm quite optimistic, and that's why we are promoting these measures. MRT is promoting this. We are very disciplined, giving sanction of people, and you can see like the message. Do you have even talk? People talk in the train. We don't allow that. So these kind of things, being disciplined, making sure social distancing measures are applied in a very disciplined way. It's something that shows this is leadership at the MRT level, and it's supported by leadership at Jakarta level. It's supported by leadership at the national level. President Jokowi made a visit to MRT stations 2 weeks ago and asking the military to help checking all the stations and helping us making people disciplined on using public transport. So these kind of things, I think the effort, the measures that is being done by the government of Indonesia.
Do you think soldiers in stations or on the trains is the answer, though?
One of the ways to help, if there is a long queue and people is not disciplined enough, so soldier and police will help the operators to put people disciplined. So this is one of the ways that we have to do it now.
Well, it's a brave new world. Pak William, I am very grateful for your time. You are incredibly busy, and I wish you all the very best.
Thank you very much, Jeff. Thank you for interviewing me.
And that's the program. If you like what you hear, please hit subscribe and rate us. It helps. Thanks to Stephen Handoko, our producer, Imam Shofwan for research, and Soundstripe for our music. I'm Jeff Hutton. We'll be back next week. Bye for now.